I want to start with the figures of people who are seriously ill with this virus in New South Wales, because they are growing now. 6 people are in intensive care. That's out of 26 people in hospital with this virus in total, and 2 people now on ventilators. So that number is starting to tick up as this outbreak continues. It's made its way into some people who are more vulnerable to serious illness here. So that is a real shame to start to see through this outbreak. It reinforces why we want to see, while our community is largely unvaccinated, why we want to see this outbreak come to an end pretty quickly, quicker than we're probably seeing happen at the moment, unfortunately. So what we've got today is another 18 local cases out of 32,000 or so test results, which we should say the numbers, the test results reported on Tuesday, they reflect the swabs that were taken on Sunday for the most part. Sunday, usually a pretty low day for testing. 32,000 any other Sunday would be a great number. During a lockdown, maybe not so much. You'd like to see those numbers a bit higher. And of those 18 cases that we've seen today, one of the key numbers that we've been watching, I'll come back to that actually, is the number of people who have spent some time in the community while they were infectious. And that number today is 7. 2 of them through their entire infectious period, 5 of them through part of their infectious period. So these numbers kind of very slowly coming down, not as fast as you might have liked to have seen. And I just want to show you this 7-day average because it kind of shows you the effect that the lockdown has had. It's clearly put some pressure, or downward pressure on this curve after we saw it rapidly increase at the beginning of this outbreak. We're now seeing on average about 25, 26 cases a day being recorded locally. That curve is flat. So all of these measures are clearly having an impact, putting some downward pressure. But as we start to move toward the end of the scheduled lockdown, well, the pressure is, clearly not quite enough at the moment to get us all the way down to zero very, very quickly.
So let's talk about that. Gladys Berejiklian has foreshadowed an announcement on whether the lockdown will be extended tomorrow. What's the health data that she's going to consider in making that decision?
Yeah, I think the single biggest number would be the number of people out while infectious, 7 of them today. You want that number really to be coming down to 0, if not all the way to 0 before that lockdown ends. I think on balance, after seeing the numbers over the last few days, you would have to think, if an announcement's being made tomorrow about what next week looks like, you would have to think on balance it's more likely we'll see some form of restrictions in the form of some sort of lockdown extended, whether it applies to all of Greater Sydney or just smaller areas, or maybe parts of Wollongong or the Central Coast can be excluded because we haven't really seen much in the way of transmission in those parts of the city. All of that would be up in the air, but on balance you'd have to think, given we're still seeing cases, a reasonable number of cases out in the community each day while infectious, given we're still seeing kind of this level of cases slowly coming down, these measures are working, just not as quickly as you might hope. You would assume that, the chances of some sort of extension are high. I'm not predicting the future here. I don't know all of the data. Obviously, New South Wales Health has a lot more data than we have, but just from an outsider's perspective, it seems, relatively likely that would be extended. Whether you would need tougher restrictions, I'm a little bit sceptical on whether a tougher lockdown itself would put, faster downward pressure on these things, because we're still seeing, most of the cases each day are household contacts of existing cases, so people being infected by people they live with. Most of the exposure sites we're seeing are the kinds of places that wouldn't be affected by tougher lockdowns: supermarkets, grocery stores, chemists, hospitals, public transport, those kinds of places. What I think would be more likely to put downward pressure would be a wider net on who exactly is a close contact in Sydney. Isolating not just the close contacts of confirmed cases, but also their close contacts. That's happening in some cases in New South Wales. It's not happening consistently in every single case. If you were to do that, as Victoria had started to do in recent months and through their recent outbreaks, you probably would see that number come down under control quicker.
Casey, your data is A+, so don't undersell it. Talk us through the pace of the vaccine rollout. It's seen a surge in the past week.
Yeah, what we've seen now is consistently a few times now, when a city goes into lockdown, it looks like vaccination numbers go up. Not that I'm saying lockdowns are good, but that's, I guess, a silver lining here. When when there is an impetus for people to get vaccinated, they are. So what we're seeing, 125,000 doses being administered a day at the moment across the entire country. That's up about 10 10,000 or so from a week ago. A small part of that will be the AstraZeneca increased eligibility for people under 40, but that's only about 8,000 doses in the 5 days and the week after that eligibility was opened up by the Prime Minister. So maybe 1,000 a day. That's not quite, that wouldn't explain all of this. What does line up, though, if I go to the state breakdown, what you can see, this is New South Wales, 40,000 doses a day, and this gets steeper. This trajectory has got steeper on the day the lockdown was announced. So we've started to see people go out and get vaccinated in greater numbers. That's up about more than 20% in the past week. We've got Queensland numbers up, I think it's about 15% in the past week. A bit harder to see on this chart, but Western Australia's numbers also up about 20% in the past week, just in terms of raw absolute numbers of vaccine doses being administered. Will that trend stay? Well, it didn't in Melbourne. We saw a big surge in Victoria during their most recent outbreak, but it subsided again at a higher baseline than before, but it did still subside from its peak. Whether that happens again, and of course I should say the size of that peak is partly because they got extra doses of Pfizer from the Commonwealth Government, which hasn't happened here. So will that subside again by this outbreak's end? We just don't know. I hope not. I hope that we see this rollout pick up, but of course we know one of the big constraints here is the supply.